Joined now from Sussex by Dr Samantha Batt-Rawden, who's co-founder of the Doctors Association UK. She works in emergency medicine, and also from Bradford by GP Dr Amir Khan. And of course, Dr Hilary is with us too. Samantha, what is going on? We hear terrible stories of nurses and doctors, people right at the coalface, at the front line, and they're having to make from scratch their own protection out of bin bags.
Morning, thank you for having me on. Yes, unfortunately, you're absolutely right. It was quite disappointing to hear what Matt Hancock had to say this morning, because the truth of it is none of this protective equipment is hitting the front lines. And actually, I think Piers has probably advocated better for frontline staff in the NHS than Matt Hancock has this morning. We just don't understand why people are gambling with our lives here. I've heard from nurses who haven't got protective gowns, who have had to make their own out of bin bags. You know, why is the government sending NHS staff onto the front line just armed with bin bags or masks that they've had to buy themselves from Screwfix? We're just, we're just absolutely terrified.
This is a war. And if it was a conventional military war and we were sending out all our troops with this kind of woeful lack of basic equipment, there would be absolute outrage. And yet we are sending health workers into a war zone from which some may not come back. It's the same thing. And they've got to be better equipped. They've
got to be better equipped. And Samantha, what about testing? We keep hearing about testing. Have you been tested? Any of your colleagues? What's your take on that?
No, so still no movement on that at all. I'm currently still in self-isolation. I feel absolutely terrible. I'm an intensive care registrar. I really, really want to be on the front lines. I've got friends and colleagues in London and around where I am who are becoming completely overwhelmed, and I can't do anything to help patients apart from, as the head of our organisation, and lobbying for frontline testing and lobbying for more protective equipment, which I'm trying to do as best as possible from home. But it's just absolutely crazy. I really want to get back to work, and we're not going to be able to do that until we see testing.
Honestly, it's at the centre of this whole problem. The lack of testing means that health workers can't get tested, which means they can't do their job, and it may be too late before we get them in.
Samantha just wants to help people. You can sense the frustration.
Of course, they all do.
Dr Khan, you've done a video telling people to stay at home. Is it having any effect, do you think? What's happening where you are?
Well, it was a disappointing weekend as a healthcare worker, really, because we saw all these images of people going out, socialising. It was really hard to watch when you know that tomorrow morning I will be going to work, as I am here now, seeing patients, and those people have put themselves at risk. And I would say to those people who were out this weekend, who were socialising and having drinks and coffees with their friends, what you've essentially done is you're pulling the plug on the life support machines that's supplying the NHS to charge up your mobile phone. That's the analogy I can give. And I echo what Dr Samantha was saying there. As NHS workers, we feel a bit like we're lambs to the slaughterhouse going into work. We haven't got the gear. I haven't got the gear here at my GP surgery. We're seeing patients. We're talking about coughs and fevers, but this illness presents with a whole myriad of symptoms, and we've got colleagues in the NHS in ITU, and we're hearing about that, and we're going to work to help people to save lives, and that's really, really important, and we're happy to do that. All we ask in return is, A, the public stay at home. It's not hard to do. And secondly, the government protect us, because we're working as hard as we possibly can for you.
You are, and we appreciate it so much. Yeah. We appreciate everything.
You're doing an amazing job,
you're doing.
Both of you. Please keep up the good work and send all our very best to all your colleagues at this extremely testing time. Testing being the ironic word.
It is indeed.